I am discussing this orthodontic shortcut because it's impossible to cover complete book in a few days for your induction exam. So better is just see quick points. So that's why I put points. If these points are beneficial, you should subscribe my channel. Thanks in advance. We will see now cleft lip and cleft palate, most common congenital defect involving face and jaw, and it occurs during the fourth developmental stage. Cleft lip, cleft lip. Sorry for a little bit inconvenience. Cleft lip we were during fourth developmental stage. Okay, lip cleft occurs because of failure of fusion between median and lateral nasal process and maxillary prominence. It is an important MCQ and it is a part 1 MCQ which occurs normally in 6 weeks. Okay, it is an MCQ too. Okay, midline cleft of upper lip because of failure of union of two median nasal process. Unilateral or bilateral cleft lip due to failure of union of maxillary and lateral nasal process. Okay. Isolated cleft palate because of failure of fusion of two palatine shells. Okay. Cleft palate because of failure of fusion of two palatine shells, while lateral because of failure of maxillary and lateral nasal process. While midline cleft lip is because of failure of two medial nasal process. Okay. These are important MCQs too. Okay, and it is an important SCQ too. Crouzon syndrome is also an important SCQ as well as important topic for MCQs. Crouzon syndrome is an autosomal dominant and it is because of mutation in FGRR2 on chromosome 10. It is an important MCQ too. Deficiency of midface structure, hypertelorism and bulging of eye. Okay, it is Crouzon syndrome. What is Apert syndrome? Apert syndrome or acrocephaly, acrocephalosyndactyly. It is also an autosomal dominant. There is anomalies of skull, face and limbs. Okay, Apert syndrome. It involves face and limbs. Now, disturbance in fetal and perinatal period. Intrauterine molding, it is because of intrauterine molding, and now we will talk about pyrobin sequence. Pyrobin sequence, it is an important SEQ too. Molding during head fixed tightly against chest cause mandibular deficiency. It is known as pyrobin because the mandible is deficient. Okay, there is small mandible, there is airway obstruction, there is cleft palate, there is glossopitosis or large tongue there, so there is ptosis of the tongue. What is mid-face? There is mid-face deficiency. During arm is mid-face deficiency when the arm is pressed across teeth. Severe maxillary deficiency at birth. There is Stickler syndrome, defect in cartilage formation. What is Stickler syndrome? Stickler syndrome is due to defect in cartilage formation. There is flat midface, short nose, hearing loss, facial asymmetry, and joint hypermobility. Okay, progressive childhood deformity. Progressive childhood deformity. We have moved very progressive childhood deformity. There is unilateral condylar fracture, cause growth deficiency, squaring managed by early mobilization. Okay, it comes these three things comes under progressive childhood deformity. First is unilateral condylar fracture, second is torticollis, third is muscle weakness syndrome. Okay, unilateral condylar fracture has been discussed. it is tortillas. Excessive contraction of neck. It was torticollis, I think so. Here it is mentioned as tortillas. So there is excessive contraction of neck muscle on one side. Affected muscle is sternocleidomastoid. It is an easy task. Muscle weakness syndrome, increase anterior face height, open bite, and excessive eruption of posterior teeth. There is narrowing of maxillary arch. Early adult life growth disturbance. Acromegaly comes under early adult life growth disturbance. What is acromegaly? It is because of increased growth hormone by anterior pituitary gland. There is excessive mandibular growth. Skeletal class 2. It is skeletal class 2. Class 2. We will see from book 2 this topic. Arthritis, increased blood pressure, diabetes, managed by removal or irradiation of tumor. After irradiation therapy, salica turcica enlarged and loss of bone definition. Dental disturbances. First is anodontia. What is anodontia? It is an important MCQ and important SCQ too. What is anodontia? Anodontia is complete absence of tooth. Okay. Oligodontia. What is oligodontia? Oligodontia is absence of more than 6 teeth. Okay. Hypodontia, absence of less than 6 teeth. Okay. Anodontia, complete absence. Oligodontia, absence of more than 6 teeth. Hypodontia, absence of less than 6 teeth. Mean 4, 5, 4, 3, 2, 1. HED, HED stand for, we will see it later on. HED, hypodontia, conical teeth. I think so. Horner syndrome. They are talking about HED, hypodontia, conical teeth. Hereditary ectodermal dysplasia. Okay, when I saw the feature, then I came to now they are talking about HED, mean hereditary ectodermal dysplasia, hypodontia, there are conical teeth, spares here, a no sweat gland, hypothermia, lack of development of alveolar process. Okay, so this was page 5 of orthodontics point. Then we will see page 6 of orthodontics point. These points are important for quick preparation of your induction exam. Supernumerary teeth and malformed teeth during morphodifferential stage. Okay, they are telling that supernumerary teeth and malformed teeth are formed during morphodifferential stage. Most common variability in size. Most variable is maxillolateral incisors. Okay, they are most variable in size. Most common supernumerary teeth is mesodense. Okay. Cleidocranial dysplasia, mutation in RUNX2. Okay. And the features of cleidocranial dysplasia are partial or complete loss of clavicle because of cleidocranial. Name denotes that it is because of partial or complete loss of clavicle, narrow arched palate, retained primary teeth, and dentage cysts are in cleidocranial dysplasia. Okay. Then tunnel tooth trauma when crown is forming.